Hi, my name is Naomin. Today we're gonna talking about a relatively new technology for the ultrasound. Let's begin! What is an ultrasound? An ultrasound or sonogram is a procedure that uses to create an image or part of the inside of the body. The technique is similar to the echolocation used by animals such as bat, dolphins, as well as sonar used by submarine. There are three main types of ultrasound: 2D scan, 3D scan, and 4D scan. How does it work? The ultrasound machine transmits high-frequency, approximately 1 to 5 MHz sound pulses into your body using a probe. The sound wave travel into your body and hit a boundary between tissues. Some of the sound wave get reflected back to the probe, while some travel on further until they reach other boundary and get reflected. The reflected waves are picked up by the probe and relayed to the machine. The machine then calculates the distance from the probe to the tissues using the speed of sound in tissues and the time of each echo returns, forming an image. So how does this image turn into 4D? 4D scan produces a real-time 3D images with time being a fourth dimension. In 4D mode, multiple set of 3D volumetric data within a continuous time frame is acquired and aligned chronologically. Okay, now that you know how 4D ultrasound works, let's look at its application in a clinical setting. Let's look at a standard clinical scenario. A 25 weeks pregnant female is coming for a regular ultrasound scan and she has requested for a 4D scan. This is the 4D ultrasound image of a fetus in a womb, showing the anatomy of a fetus and its motion in real time. For example, here the baby is yawning and moving laterally. The 4D images show that the baby is happy and healthy, and there is no malformation in any other anatomical parts of the body. Now, we will be looking at a more complicated scenario. A 56-year-old male complains about muscle fatigue, shortness of breath during light exercise, and the swelling of his feet and ankles. An ECG shows abnormal heart rhythm and pulmonary hypertension. 4D ultrasound is then performed to assess his heart function. These are 4D ultrasound images in an axial plane. The image on the left shows a normal mitral valve, and the image on the right shows an abnormal mitral valve. On the right image, the bulge of posterior leaflet indicates a failing of mitral valve. This is a common condition called MVP, mitral valve prolapses. The 4D scan also shows incomplete closing of a mitral valve. This suggests that the patient is suffering from a mitral valve regurgitation.
3D, is three spatial dimensions. And if you include the temporal dimension, which is time dimension, so that's fourth dimension. So we put this all together, we call it 4D or 4 dimensions. And it's mainly used in imaging of the dynamic body parts, fetal heart, adult heart, or other body parts. And in terms of clinical application, some fetal heart movement is very complex and structurally complex. And also because it's beating so fast, if you use conventional 3D imaging approach, you will get imaging with motion artifacts. So that's why we need a 4D to remove motion artifacts. In terms of ultrasound, because it's a very safe imaging modality or tool, It doesn't like X-ray, which have ionizing side effect. So that's why ultrasound is used in the fetal study or imaging as a first line. My main interest is in the fetal heart. We have to find a way to remove motion artifact, because in adult study you use ECG, but in the fetus you do not have ECG because the mother's ECG and the fetal ECG all together mixed together. So we have to find a way to extract the time information from the fetal heart movement. So what we got is to use the fetal heart movement on ultrasound. We call it M mode. So from M mode movement of the heart, we can actually pinpoint at which time point in the cardiac cycle and the heart is imaged or visualized. And then we use that time as a fourth dimension to visualize the heart in 4D to remove motion artifact. If you have a very complex heart malformation, like this transposition of great arteries, the invent of 4D ultrasound has helped clinicians to detect those complex malformations and with certainty. 4D has no real meaning for visualize some simple cardiac malformations like a ventricular septal defect, atrial septal defect.
Thank you so much for watching. Please give a like, subscribe and comment if you have any questions.